I also hear from women who've suffered with fibroids, endometriosis, female troubles, as you share in your
Mhm.
book, and have a fair amount of anxiety about stepping through perimenopause and into menopause. Um, Anything that you might offer to those women, that large swath of women, as they navigate perimenopause and menopause and are interested in hormones?
Yes. Now, here's if there's any good news about fibroids and endometriosis, is that these conditions tend, even though they are dependent upon estrogen for the maintenance of their fibroids and endometriosis, after menopause, they do get better. So at the very least, when you get to menopausal age, your fibroids, no matter what trouble they've been causing you with heavy bleeding or even just the bulkiness of the fibroids themselves,
Right.
um, once the estrogen sort of goes away or really goes down, that gets better. The same is true
Okay.
for endometriosis, because if you think about it, for women with endometriosis, one of the treatments that we have for women with endometriosis, you know what we do? We put them in temporary menopause,
Right.
and often in anticipation of surgery. But you take away the estrogen and just sort of shut everything down, and the symptoms will regress. The problem is if you let a woman have her cycles back naturally, the endometriosis will tend to come back.
Okay.
However, and here's a big however, you say, well, it's the estrogen, it's the estrogen. You know what the other treatment is for women with endometriosis? Birth control pills. We use birth control pills all,
All the
all,
time.
all the time for suppressing endometriosis. So it's not the estrogen itself that's the problem. It's the it's the cyclical nature. When
Mm,
the estrogen goes up in a normal cycle and it goes down when you get your period. But once you're on birth control pills, you're on the same
steady.
every day. So that actually suppresses endometriosis. So what does that mean about menopause? That means that if you have either of these conditions, they're likely to get better and regress during menopause. What does adding hormone therapy back after you're like, oh, great, now I don't have to worry about my endometriosis. Am I going to make it come back with hormone therapy? Answer that question. Typically not, because the amount of estrogen that you take every day is much smaller than what you would make in a normal cycle. That's one. It's only about a quarter to a half the dose of even the lowest dose birth control pill is. And remember, it's not just the estrogen, it's the cyclicity of it that causes the problems. And when you're on birth control pills, you stay level. When you're on menopausal hormone therapy, you stay level. So I have not had anyone ever personally, from my 30 years of experience, who has gotten to menopause and then their symptoms are better, and I put them on a low dose menopausal hormone therapy to treat their symptoms
Yeah.
and have their either of those conditions get worse or come back.
Terrific. Thank you so much.